Hello everyone, welcome to Dentospedia, which is the most trusted platform for any dental board exam. So today we are going to study viral infections of the oral cavity from the module of oral pathology. So let's begin with the topic. Virus. Next is Coxsackie virus. So see, it involves hand, foot, mouth disease and herpangina. Understood? So Coxsackie virus commonly affects children and produces vesicles that ruptures into ulcers in the oral cavity. So first is hand, foot, mouth disease. So see, what are the causes? So I have told you cause will be Coxsackie virus A and sometimes enterovirus 71. Understood? So see, clinical feature. So there will be small vesicular ulcers on the tongue, buccal mucosa, hands, feet and buttocks. Now there will be fever, sore throat and malaise. Understood? So there will be small vesicles or ulcers in the mouth or tongue or buccal mucosa. Understood? Now skin lesions on hands, feet or buttocks. Understood? Now it is an important distinguishing feature in the buttocks. Understood? Now what are the systemic symptoms? So there will be low grade fever, sore throat and malaise. Understood? So see, oral plus hand plus foot lesion together forms hand, foot and mouth disease. Understood? You can see in the image as well, there is a small vesicular ulcers. Understood? Now next is herpangina. Next is herpangina. So see, the cause is Coxsackie virus A and the clinical feature are, see, there will be posterior oral ulcer. So you can see there is a posterior oral ulcer in the soft palate or tonsillar pillars. Understood? So there will be posterior oral ulcers in soft palate, tonsillar pillar or uvula. Now lesions are small but very painful. Understood? Now see, what are the systemic symptoms? So there will be high fever and sore throat. Understand? There will be also dysphagia, which is difficulty in swallowing. Now see, posterior mouth ulcers plus high fever is herpangina. Now see, Coxsackie virus affects both oral mucosa and skin. Now the diagnosis. See, diagnosis will be usually seen clinically. Understand, there will be clinical presentation and viral PCR if confirmation is needed should be done. Understood? Now what is the treatment? So see, treatment is usually supportive. Understand, supportive treatment is required like hydration and analgesics. Understood? Hydration, analgesics, antipyretics. Now no antiviral treatment is usually required. Now see, next is human papilloma virus or oral warts. So see, HPV causes benign epithelial proliferations in the oral cavity. Now, types of oral human papilloma virus lesion. So first is squamous papilloma. First is squamous papilloma. So see, it will be small, painless and cauliflower-like growth. So please remember this cauliflower-like growth. Understood? There will be small, painless, cauliflower-like growth and is common on tongue, lips, and soft palate. Now, next is condyloma acuminatum. Condyloma acuminatum. Now, it will be larger and there will be multiple warts. Now, it is often sexually transmitted. Understood? There will be larger, multiple warts and often sexually transmitted. Now, next is focal epithelial hyperplasia or Hex disease. Please remember this also, Hex disease. Now these are multiple flat-topped warts in children. Understood? There will be multiple flat-topped warts seen mainly in children. Understood? So see, HPV oral lesions are painless, verrucous and persistent. Now you can see human papilloma virus, you can see the cauliflower-like growth. You can see cauliflower-like growth. Understood? These are the warts, oral warts. Now see, what will be the diagnosis? So diagnosis will be biopsy or human papilloma virus typing. Understand, if needed. Then treatment. So there will be surgical excision, cryotherapy or laser therapy. So these are the treatment. So see, what are the difference between Coxsackie virus and HPV? See, the lesion in Coxsackie virus, there will be vesicles which burst to form ulcers. Understood? And in HPV there will be oral warts. Now in Coxsackie virus there will be painful ulcers. Understood? But in HPV, it is painless. Now, the size will be mouth, hands, and feet. It will spread in mouth, hands, and feet. And in HPV, it will spread in oral mucosa. Understood? Fever will be present in Coxsackie virus and will be absent in HPV. Understood? Now, treatment is supportive in Coxsackie, whereas surgical removal is required in human papilloma virus. Now, see, hand, foot, mouth disease, oral ulcers with hand and foot lesion caused by Coxsackie virus. In Herpangina, there will be posterior oral ulcer with high fever in children. And in HPV, oral lesion will be painless, cauliflower-like warts in the oral cavity. Understood? So that was viral infections of the oral cavity. So for more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.